الو الو، سامعيني؟ مش شغال المايك. طب سامعيني صح؟ طيب. So can we go ahead and start؟ طيب، كنتوا تدرسوا بالعربي ولا بالانجليزي؟ بالعربي. طيب انا راح ادرسكم بالعربي.
السلام عليكم، كيف حالك؟
هلا، الله يجزيك الخير.
المحاضرة هاي
بعرفه، بده المايك القاعة الثانية. طيب راح نبلش، راح نعطيكم محاضرة اليوم عن البكتيريال مننجايتس، اوكي؟ راح احاول اني ادرسها بالعربي ان شاء الله. شنو على هالراي؟ هاي في تسجيل يعني. طيب. So what are you looking at here at the slide؟ شو شايفين؟ اللي مش فاهم شو بحكي يرفع ايده، صح؟ غلطان انا؟ طيب what do you see on the slide؟ ها؟ شو شايفين بالسلايد؟ شايفين بكتيريا؟ شو بتعمل بتسلم عليكم؟ You see inflammation. Okay. What do you see though? What are you looking at? What is this? The CT scan of the brain. So we're looking at the cortex of the brain and the brain matter. مش هيك؟ The first picture, it's ايش؟ شو الباثولوجي او شو المانيفستيشن here؟ It's atrophied. مش هيك؟ atrophied. سلامة الله. وين كان يا عمو؟ وين؟
صرت الحمام.
الله يقويك. يلا ماشي. طيب atrophied, where this is the initial pathogenesis of an acute bacterial infection, okay? And then it becomes what? As a chronic manifestation of bacterial meningitis, more fuzzy, more hazy. You can tell there is more swollen, right? طيب تمام. So bacterial meningitis, the point I'm trying to get across to you, that bacterial meningitis is a serious disease with rather grave sequences or consequences that could very much lead to death. Okay? And we, as clinicians, are in the business of saving lives and making lives better. Check? That's why we're here today. Check? صح? طيب. So this is the talk outline. We'll try to cover the first half, لعند pathogenesis, and then inshallah tomorrow we'll finish the second half. Okay? Okay, good. So here you're looking at the meninges, and I'm assuming you're familiar with the meninges from your anatomy. مش هيك? And then you're looking at the inflamed meninges with an itis, from Latin dictates an inflammation. هلا كل inflammation is an infection ولا كل infection is an inflammation? كل infection is, but not every inflammation necessarily is an infection, right? We have allergic diseases, we have autoimmune diseases. مش هيك؟ واحد نايم متأخر صبح inflamed. Believe it or not, that's true. Meningitis. So the disease itself caused by all microorganisms that captures up the opportunity of getting into the meninges. The meninges are rather securely protected by many layers, including the famous blood-brain barrier. مش هيك؟ فمش كل الميكروبes are able to go through the blood-brain barrier to cause an infection. And that alone tells you that those who cause meningitis are rather more ايش؟ more virulent. So they possess more virulent properties that enable them to cross the blood-brain barrier and establish an infection. What are the virulence properties of bacteria? Can you list them out for me? تفضلي. شو virulence properties? تفضل. Capsule is one, toxin is another. What else? True. What else? How a bacterial infection starts normally? With entry. مش هيك؟ بعد الانتري شو بصير؟ ليش متأخر عمو؟ وين كنت رايح؟ كنت واقف هون. والله أنا بحب الصدق في الكلام. أحسنت يا ولدي. لا تكذب. شطور. تفضل. كان واقف هون. احكي هالحكي لمدير مستشفى بس تصير طبيب قدام. اوكي. قال المريض مات. وين كنت؟ كنت واقف هون. طيب, so we start the infection with entry. After entry شو بصير؟ adhesion. So we have adhesins such as the pili and the fimbria, مش هيك؟ تمام. بعد الادهيجن بصير شو؟ establishing a colony, colonization. After colonization, normally there is a dissemination of the infection to other organs, including, طبعا the dissemination occurs through 2 routes, مش هيك؟ أو 3 routes. The first route is the highway of the body, which is what? The bloodstream. And that's what we call bacteremia. يعني bacteria in the blood. Emia means blood in Latin, مش هيك؟ So bacteremia يعني blood or bacteria in the blood. So that bacteremia. The other route is the lymphatics, أحسنتم. And the third route is adjacent tissues and through the interstitial fluids and secretions. Third space بنسميه بالanatomy, right? Third space. طيب. So كل هذول viruses, bacteria, fungi, protozoa, and elements are able and capable of establishing an inflammation of the meninges given the opportunity. فمش كلهم are able to do that. Those who possesses virulence properties that we discussed. تمام? تمام. So in your opinion, the one with the phone, okay? And I'm assuming they're writing notes on their phone. They're not texting or talking to someone else. صح؟ أنا بحسن الظن. So, in your opinion, which one of the 3 is the most common cause of a meningitis? Bacteria, virus, or fungi? Bacteria. اللي بيقول بكتيريا يرفع ايده هسه. اللي بيقول بكتيريا يرفع ايده. طيب اللي بيقول فيروس يرفع ايده. والله انتم اشطر من ال 500 هذاك. So viruses are in fact, statistically speaking, epidemiologically speaking, are more common around us. مش هيك؟ شو بدك تحكي؟ شو بدك تقول؟ فيروس ولا بكتيريا؟ فيروس؟ فاحنا يا جماعه just to understand the very basics of infections, we as humans are swimming in an ocean of microorganisms. They are in us, on us, and surrounding us. Okay? The most common type of those microorganisms is viruses, and thereby they are the most commonly causing infections to the human body. بكل بساطة. Starting from the flu to the rota. يعني من فوق لتحت. Okay? From the flu to the rota that causes gastroenteritis. Okay? So that's why you see viral infections to be the most common cause of meningitis. What type of meningitis they cause? Aseptic ولا septic? Aseptic. أحسنت يا ولدي. أحسنت. The definition of meningitis is written on the slide, so you can read through it and understand it. تمام? And the idea of acute infection, generally speaking, is talking about hours to few days. مش هيك? Whereas chronic manifestations or infection, it's more than that. تمام؟ واضح؟ Epidemiology. Why is it important that we study epidemiology? شو أهمية epidemiology in our life? It helps us in diagnose things. تفضلي. Yes, and it also helps us understand the circulating serotypes and phenotypes of different microorganisms in our local community here in Irbid and Jordan at large, okay? And if you understand that, then you have a higher index of suspicion, then you are dealing with the right pile of medications, antimicrobials and what's not, and thereby you are able to do a more proper management. يعني أنت قاعد بالكلينيك, okay? And you see a lot of flu patients that day. أغلب, most likely, the people that you'll be seeing in the afternoon will be similar to the morning with the flu. تمام? Similarly, if children from a daycare, يجي أول واحد والثاني rota, okay, vomiting and diarrhea, and it's most likely a rotaviral infection, مش هيك? Then the rest of them will be. So this is a very narrow angle على الepidemiology. But at the bigger scheme of things, we know what are the circulating serotypes and phenotypes of microbes in our community, so we are able, number 1, to prevent, and number 2, to treat properly. Okay? يعني مش بنعالج المريض from one issue and he end up with another issue. And that's the idea. Okay, so preventive medicine is key. And that's why we're telling you here some statistical data the dissemination and the propagation of meningitis. And then we're thankful to some of the vaccines that are available nowadays that drop the incidence rate of one of the famous ones, strep pneumonia, for example, okay, from 0.61 into 0.01 per 100,000. Highlighted in the slide, you can see that, okay? And this is testament to the effectiveness of vaccine of preventing disease. But is that the whole story? No, this is not the whole story. Once you get rid of a bug, there is a vacuum in that ocean that I referred to earlier, right? Other microbes will come in and fill that void, okay? And then you start seeing new emerging infections, new bacterial and new viral strains, okay? And this is a story of modern medicine, okay? We intervene, we provide an antimicrobial agent, and then we kill that bug that caused the disease earlier on, tamam? Then other bugs will come in and fill in the void. And this is fitness and survival. This is a surface, okay? شايفين الsurface? This is a surface, okay? On this surface, there are thousands and thousands of bugs. If I bring a certain antiseptic, okay, and I wiped it out completely, حلو؟ 99.9 مش هيك الدعاية تبع الديتول بتقول 99.9 طيب 99.999 طيب now I've wiped it out. Did I kill all the bugs? لا. طيب the remaining few اللي ضلوا شو راح يصير فيهم؟ They will replicate, they will grow لأنه they are in the business of fitness and survival. How do bacteria survive? They grow, they multiply, okay? This is what they do. Now they have all this empty land space for them to grow, acquire nutrients, feed off the dead bodies of other bacteria and metabolites, etc., and proliferate. And now on this surface, I have more of that bug that we never heard of. ولا عمرنا عالجنا ولا في له antibiotic. And now, because we are living on this surface, assuming we are tiny people and we are living on this surface, okay? We are getting exposed to this bug, مش هيك؟ تمام؟ And now we are dealing with new infections. And this is the story of penicillin. لما كان البنسلين kills 99% of all the bacteria. And, those who did not die by penicillin by chance, they acquired that genetic function that helps them get rid of penicillin. By complete chance, complete randomness, okay? And now they're big players and they multiply. لأنه إحنا as humans intervened in the natural history of a process by providing an antimicrobial agent سميناه penicillin. تمام? And now you are dealing with new type of bacteria. بعدين بنجيب another antibiotic. The same story happens again, and then you are dealing with another emerging bacterial or microbial infection that you need to have another antimicrobial agent for. And this is the story of big pharma and antibiotic stewardship, and it's a vicious cycle of emerging and re-emerging of microbes. Right. All the way to the sub-Saharan Africa, in which they did serotyping of the circulating bacterial infection. The big players, as you can see here, highlighted strep pneumonia, Neisseria meningitis, and Listeria monocytogen. You can safely assume إنه عندهم more virulence properties, مش هيك? And that's why they were successful in establishing a bacterial infection in the meninges crossing the blood-brain barrier. So that's the story, okay? So if I were to ask you, you would say these are more virulent, صح? Okay. So this is meningitis belt for you to appreciate the value of epidemiological data in Africa, highlighting the countries in which you see more bacterial meningitis. Do we need such studies and things like this here in our country? Of course we do, and hopefully that's in the making. Microbes, starting with viruses, as we all agreed, it's the most common cause of aseptic meningeal syndrome, moving to other viruses, ending up with the value of some vaccines for H influenza type B that gets rid of this rather nasty infection that causes meningitis. And again, when we do that, other subtypes will come and fill the void and cause infection again and again. And this is the blessing and the disadvantage of modern medicine. Okay? زمان اللي كان بيمرض كان بيموت. Check. That was the story. Now we have these interventions that helped so many people and disadvantages us as well, and creating this new challenge that we deal with every now and then. طيب. Listeria is another example. Group B, streptococci. Listeria, شو احنا لما نحكي listeria, we remember unpasteurized cheeses. Someone traveled to France, wanted to sample some fancy cheese. Okay, and they end up with listeria. Okay. Prophylactic group B strep. And prophylaxis here for whom? For the mom, مش هيك? So we can protect the neonate, the newborn. Okay. Gram-negative bacilli on the rise as well. ليش؟ لأنه it's normally is introduced because of two things. You are clearing off a lot of the bad ones because of vaccines and prophylactic antibodies. مش هيك؟ Antibiotics عفوا. You are clearing up the way, opening up an opportunity for them to try to cause the infection, and as well as a physical barrier damage, such as head trauma or neurosurgery, breaks the physical barrier, the blood-brain barrier, and thereby they are able to establish an infection. So watch for gram-negative bacilli. هلا بنحكي عليهم in the following slides. Okay? هلا, generally speaking, the etiology over the years changes, but the big players remain, and this is true for any given country, more or less. So as you can see, H. influenza, Neisseria meningitis, strep pneumonia, agitation, and listeria, and how the incidence changes over time. Nevertheless, what's constant in this equation is what? Those who are more prone or susceptible to get the infections. And those are the geriatric age group, the neonate, and the elderly. What's the common feature between the two? Their immune system either underdeveloped or immature, or it's weakened, not as robust as someone in their young lifespan from 20 to 30 to 40 to 50. Okay? Okay, good. طيب, تمام. Again, another testament to those with the infections over time. You can see different countries over time and how the changes in the bacterial infections and what microbes are able to establish a bacterial meningitis. This helps us understand the value of epidemiological data. Now, the more important thing that really helps us in the clinic in a more practical way with a high index clinical suspicion is to know that you are dealing with a less than 1 month old or a less than 2 year old, or to know the age, okay? That's number one. And then to know the risk factors, okay? For those who are more prone or susceptible to infections. Well, normally, that age group, they have one thing in common, which is weakened immune system, okay? And you can see how the big players from age 2 to 50, and you can safely guess they are the most virulent, مش هيك? They are the most virulent, strep pneumonia and Neisseria meningitis, 2 to 50. And then in the other extremities of the age, whether it's less than 1 month or less than 2 years or more than 50 years, you see the introduction of other microbes. And this is also true for immune compromised, head trauma, that's the physical barrier breakage that enables other bugs to cause the infection. So the idea here is history taking, proper history taking and exam helps us understand the issue of that subject and treat them accordingly. Okay? So this table is quite important because it sort of highlights what are the causative agents for each age group. Haemophilus influenza. As I said earlier, Haemophilus influenza is what is now being seen less because of the vaccine. Yeah. Normally it peaks at early age, and normally it associates with those with weakened immune system, as you can see here. But because of the vaccine, we are seeing less and less of it. As a fruit for thought, do you see the X-ray on the slide? What do you see bil X-ray? Why am I putting the X-ray on the slide? شو المشكلة? What is it? What we're looking at here? شايفين الارrow? There's an arrow. What does it highlight? highlights a clinical manifestation for Haemophilus influenza called the thumb sign. مش هيك؟ The thumb here dictates what? Inflamed or swollen lymph nodes for a child who did not take the vaccine, and they come to the emergency drooling, toxic looking, with their mouth open and drooling like a dog, okay? Now, if you wanted to kill that child, you introduce the tongue depressor to examine the throat. That's how you kill them, okay? And because we are in the business of saving lives and making lives better, we will call the anesthesiologist, okay, and call for an X-ray to directly intubate them to save their lives, and then decide on the infection, start an empirical antibiotic treatment, okay? Because the moment you use your tongue depressor for a suspected drooling child with a suspected Haemophilus influenza infection, the toxins and the shock and the immune system will suffocate them and they will die, okay? And they have rather small, narrow airways. They're children, check. But remember this for your clinical years. Haemophilus influenza, we don't see it as much, alhamdulillah, we have the vaccine, but I'm just saying, in case you see this, encounter this, remember it, okay? So this is Haemophilus influenza, an influenza type B vaccine. Type B vaccines mean what? The serotype type B, مش هيك? In which it has the capsule that enables it to evade the host immune responses and successfully enter through the blood-brain barrier and cause the infection. صح? طيب. Do bacteria talk to each other? Yes or no? Yes or no? طيب بقول yes يرفع ايده. طيب اللي بقول no شو؟ يرفع ايده. طب اللي بالحياد يرفع ايده. كوش ترفع ايديكم انتم؟ هذه فكره يعني. So what do we mean by talk to each other? So we're talking to each other, صح? Through an evolved sound language system that we created as humans, مش هيك؟ نحكي مع بعض. So we talk to each other, and this is how we communicate, صح؟ فاهمين شو بحكي ولا لا؟ طيب. So we talk to each other, and this is how we communicate. So do bacteria communicate with each other? Chemistry, تفضل, in the back. أحسنت. شو اسمك؟ سيف؟ Transferring genes. This is how they talk to each other. The method in which they transfer genes to each other through transformation, transduction, and conjugation. تمام? So this is a haphazard, random process in which bacteria exchange their genetic material with each other. Random, haphazard, it could lead to two things: acquiring a function or loss of function. That might be determinant إنه they die, for example. Or acquiring a function that now they are more resistant to a certain antibiotic. Okay? واضح? So Saif will talk about transformation. Your name? Ayham? Ayham will talk about transduction. وحدا من الصبايا will talk about transformation. So tomorrow, inshallah, each one of you three will have 5 minutes to talk about the assigned task to you. Okay? Transformation, transduction, and conjugation. مهم ليش؟ ليش مهم؟ لأنه إحنا we avoid to go to hospitals. Why do we avoid going to hospitals? Why do you hear about someone who went to the hospital for nose procedure, يعني purely cosmetic, okay? And then they end up acquiring a bacterial infection from the hospital, and it's debilitating condition, and they lived with the consequences and suffered from it from 6 months. ليش? Why bacteria in the hospitals are worse than those in the community? Why do we say nosocomial infections are more severe than community acquired infections? بشكل عام community acquired يعني lesser severe. شو الفكرة؟ الفكرة إنه bacteria talk to each other, مش هيك؟ They talk to each other on this surface, and even worse if you have 4 people in the same room or in the same wing. وبشكل عام احنا people who are admitted to the hospital, they're normally less sick ولا more sick? More sick, صح? It's more severe cases that dictate someone to be admitted to the hospital. they're really sick مش هيك؟ فيو bring in group of sick people and you put them in the same vicinity سميناها مستشفى okay سميناها hospital and then the bacteria the bad bacteria that's so severe that causes so severe infection that admits them to the hospital they start talking to each other through transformation, transduction and conjugation and as a result we see an emergence of superbugs in the hospital. In fact, some hospitals they were demolished because they used all sorts of cleaning and laser and ultraviolet light to be able to get rid of the infections and they failed. كل واحد بيدخل المستشفى فورا elective procedure okay you want to make this eyebrow higher than this one for example okay then you end up with an infection okay so that's the story of how bacteria talk to each other and this is why we said certain vaccines such as the one for Neisseria meningitis متى هذا بتشوفوا Neisseria meningitis vaccine تسمعوا عنه كتير after رمضان شو في after رمضان العيد بعد العيد وين بنروح الحج أحسنتي يا بنيتي نعم بنروح على الحج and thereby there are millions and millions of people who are aggregated in a small vicinity and thereby we do and at al-Hajj they do require us to take the vaccine to prevent the dissemination of the infection. Similarly for the pneumococcal conjugated vaccine PC7 هذا ال PC7 with time النمبر 7 زاد صار 10 بعدين صار 20 هيني بحكي عربي ها ليش؟ What's the story here? Covering more أحسنتي covering more serotypes طب ليش يا دكتور؟ Because you cleaned the area from 1 to 7 with the vaccine, they are unable to cause meningitis, مش هيك? And thereby to fill in the void in this ocean of microbes that we live and swim in every day, and we are nothing but a colony of microbes. تعرف هذا الحكي صح؟ In your skin, in your mouth, in your guts, everywhere. Okay? تمام. They fill the void and then you're looking at new serotypes. And then modern medicine comes in and create vaccines to cover these serotypes. 13, all the way up to 20 nowadays was approved by the Federal Drug Administration in the US of A in 2021. Okay? And there are over 90 serotypes known. And if you were to guess, maybe in your lifetime, we will see PC50 or PC90 even to cover the 90 serotypes, if that's applicable, of the bug that causes the disease. But the bottom line, we as human race trying to become more fit to survive and live longer. الشيء القصة هيك. Modern medicine was introduced so people can become healthier and live longer. That's the quest. Everyone is after this. Okay? And by doing so, we are challenging the microbial population that are surrounding us, in us, and on us by removing certain proportions of them, thinking that we are creating an infection, and yet we are creating an emerging infection. Tamam? And that's the back and forth. That's the story. From the invention of penicillin in 1927 till today, this is what we're living in. Okay? Okay. ولا كانت الدنيا أبسط بكثير. كان اللي بيمرض يموت وخلص. I'm not saying that's the right thing, but I'm just saying this is new. This is the new medicine. That's the intervention part. We agreed Ayham, Saif, and Hala. Hala will talk for 5 minutes about the assigned topics, and feel free to use 1 or 2 more colleagues with you to present it. You only have 5 minutes. No PowerPoint slides, okay? توقفي هون بتحكي عن ها؟ مش فاهم. شو حكينا لك؟ transformation, conjugation, transduction. بدكم تعملوا 1 slide مسموح لكم. one slide. طيب, so that's one take home assignment. Listeria monocytogene is another, and as I said, it's everywhere and it normally contaminates food. And as you can see here, عم نحكي coleslaw, although احنا هون ما بنعرفش الcoleslaw ولا صرتوا تعرفوه. في coleslaw, بس احنا and I try to put my slides in a way that are more for those who are interested in the USMLE. So course life, you see it on the exam and the manifestation of such, then listeria is on the top of the list of suspected agents that caused the infection. This gene, this tolerance gene, I put it here on a purpose so I can explain to you how a circular DNA material that we call the plasmid can be transferred through conjugation from a bacteria that has it to another that doesn't, and thereby it acquired a new function, and now it is resistant, and then you need to give a more broad spectrum antibiotic to get rid of it. How the process is completely random and haphazard, but us humans made it even more frequently happening by bringing in people in a close proximity in a place we called hospital. Okay? And that's why you see a lot of outpatient clinic nowadays. To avoid these issues, we created in healthcare the concept of outpatient clinic. بتعالجوا مع السلامة. We created another concept. تعرف شو اسمه? Day surgery. Procedures, elective procedure, عند ضبط خشمي, okay? نفس اليوم تعمل عملية بتروح. We lessen the time that you spend in the hospital as much as possible to avoid unwanted infection of really super bugs that exist in the hospitals, okay? Okay. That doesn't mean go and visit your loved one in the hospital. You should still go and visit them. Group B streptococci, we normally give antepartum antibiotic for the mom if the colonization or the culture turned out to be positive, مش هيك? And that's part of the prenatal care. So intrapartum antibiotic prophylaxis is the story here to remember. Anaerobe gram-negative, as I said, anaerobe gram-negative, the common feature, and again, for the exam, something that red flag this question for you is a trauma or a neurosurgery of some sort that enables you to know that there is a physical barrier damage, enable that this rather unusual gram-negative bacilli to cause an infection, okay? E. coli with K1 antigen, for example. The K1 antigen, believe it or not, the polysaccharide structure is identical to that of Neisseria meningitidis. فمعناته most likely it was acquired through transformation or conjugation at some point. مش هيك؟ When we say E. coli that causes meningitis, rather very unusual statement. If it is a K1 antigen positive E. coli, then yes, it is possible, especially if there is a trauma or a procedure or a road traffic accident. هذول اللي بضووا الضوء وانت ماشي على الشمال بصير يضووا لك الضوء، ها؟ يعني ديروا بالكم حالكم. Staph also causes meningitis, all right? And normally we're looking at a neurological procedure, and we're looking at a shunt, a CSF shunt. Have you heard of a CSF shunt before? So when I say stuff that you never heard of before, it's okay. All you have to do is search for it, look it up, and be on your own as you are enjoying having fun being a medical student, okay? It's a quest, it's a challenge. You challenge yourself, you acquire new knowledge, you apply that knowledge, and this is how you become a good doctor, okay? لا أنا ولا عشرة مثلي بيعلموك تصير طبيب. You are the one who decides your career development and faith in medicine. Okay? So hospital acquired or healthcare acquired, and staph epidermidis, believe it or not, it's on our skin, مش هيك؟ Epidermidis. It's part of the normal microbiome of the skin. إذا بنحكي CSF shunt, then the answer is بالامتحان epidermidis. Okay? Good. طيب. Now, we have assigned some of you for a take-home. I would hope that this would be a fun, enjoyable experience. I'm not about memorization. I'm more about understanding the topic, make it more familiar, especially so with microbiology. It's so dull, صح ولا لا? There's so much to memorize. But the idea, or how can you conquer microbiology and clinical microbiology in relation to human health and disease conditions, is to make it familiar. You talk about it, you relate to it, you watch a video, okay? You study it with others, and this is how the information is stuck. And even better, practice it hopefully in a few years. Okay? So here you can see the story, how it all starts. Starts with what? Nasopharyngeal colonization. Is that the only route, doctor? No, it's not the only route. One of the routes. But nasopharyngeal colonization is the story. And here in the red box, where the fight happens between the invaders and your immune system. So you're on your phone. Are you on your phone because you're writing notes? ولا أنت you are busy with something else? هلا in my previous institution اللي كان على تليفونه كنت أسأله هذا السؤال. أنا I assume الخير في الجميع. فإذا بيحكي لي I'm writing notes دكتور بقول له أوكي. بس إذا بكون يعني not writing notes باخذ منه التليفون. فشو رأيكم؟ Should we apply this here؟ تفضل. نعم؟ لا والله مش عنك حبيب، والله ما هو عنك، أنا آسف. مش أنت اللي أنا ما شفتكيش أصلاً. المهم we will stop here with the red box. That's where the fight happens. انتوا بتعرفوا إنه some microbes they literally incite your immune system on purpose, okay, to cause this chemotaxis and cytokine storm that leads to the extravasation of a lot of fluids, fever, that helps it hide from the immune system. So that's the red box. That's where the interplay happens. And if you want to do me a favor, just look at this slide as well, because this is the zoomed in, this is the zoomed out, and this is the zoomed in image of the molecular pathogenesis of microbial infections. In this case, we're using two examples, strep pneumonia and Neisseria meningitis. Here you're looking at the blood flow, and here you're looking at the blood-brain barrier. Okay, and how it interacts with the different receptors and the different virulence properties to successfully establish an infection. Questions? فيش أسئلة؟ طيب. Thank you everybody. See you tomorrow, inshallah. Yeah.